My name is Carolyn Stahlhut, and I'm a nurse practitioner. I recently retired from Bucksmont Urological Specialist in Lansdale, Pennsylvania, which is part of Jefferson Health. I have been a registered nurse since 1981 and a nurse practitioner specializing in urology since 2002. I worked in general urology with a particular interest in overactive bladder. SMPA is a beta-3 adrenergic agonist indicated for the treatment of overactive bladder with symptoms of urge urinary incontinence, urinary urgency and frequency in adults, overactive bladder symptoms of urge urinary incontinence, urinary urgency and frequency in adult males on pharmacological therapy for benign prostatic hyperplasia. SMPA is contraindicated in patients with known hypersensitivity to vibegron or components of SMPA. Hypersensitivity reactions such as angioedema have occurred. SMPA is a beta-3 adrenergic receptor agonist. It selectively binds to beta-3 adrenergic receptors in the bladder to relax the detrusor smooth muscle and increase bladder capacity. SMPA was studied in a 12-week phase 3 multi-center randomized double-blind placebo and active controlled study. The trial enrolled over 1,500 participants aged 18 to 93. At 12 weeks, patients on SMPA had a statistically significant reduction in average daily urge urinary incontinence episodes, average daily micturition frequency, and average daily urgency episodes relative to placebo. 98.5% of the patients did not need to discontinue secondary to adverse events. The most common adverse events experienced in the study were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory infection. SMPA is generally well tolerated. It may be especially appropriate in patients who have hypertension, depression, and other comorbidities, as there is no blood pressure warning in the label and no interaction with CYP2D6 substrates. In the phase 3 randomized double-blind placebo-controlled COURAGE trial examining SMPA in male patients with OAB and BPH, hypertension was a treatment emergent adverse event in 9% of patients receiving SMPA and 8.3% of patients receiving placebo. Again, the most common reactions reported for SMPA were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, upper respiratory infection. Urinary retention and angioedema have occurred. Please continue watching this video for the full important safety information. SMPA is available in a once daily 75 milligram dose, which requires no titration. It can be taken with or without food, swallowed whole, followed immediately by a glass of water. If necessary, SMPA can be crushed in a tablespoon or 15 milliliters of applesauce, followed immediately by a glass of water. This is particularly useful in some patients who reside in long-term care facilities. In my patients treated with SMPA, I saw efficacy in the 3 overactive bladder symptoms of urge urinary incontinence, frequency, and urgency.
Indications and usage. SMPA is a beta-3 adrenergic agonist indicated for the treatment of overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adults. Overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adult males on pharmacological therapy for benign prostatic hyperplasia, BPH. Important safety information. Contraindications. Gemtesa is contraindicated in patients with known hypersensitivity to Vibegron or any components of Gemtesa. Hypersensitivity reactions, such as angioedema, have occurred. Warnings and precautions. Urinary retention. Urinary retention has been reported in patients taking Gemtesa. The risk of urinary retention may be increased in patients with bladder outlet obstruction and also in patients taking muscarinic antagonist medications for the treatment of OAB. Monitor patients for signs and symptoms of urinary retention, particularly in patients with bladder outlet obstruction or patients taking muscarinic antagonist medications for the treatment of OAB. Discontinue Gemtesa in patients who develop urinary retention. Angioedema. Angioedema of the face and/or larynx has been reported with Gemtesa. Angioedema has been reported to occur hours after the first dose or after multiple doses. Angioedema associated with upper airway swelling may be life-threatening. If involvement of the tongue, hypopharynx, or larynx occurs, immediately discontinue Gemtesa and provide appropriate therapy and/or measures necessary to ensure a patent airway. Adverse reactions. Most common adverse reactions greater than or equal to 2% reported with Gemtesa were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory tract infection. Please see accompanying full prescribing information.